Kia ora koutou katoa. I want to start today by sharing some good news, which is not often the case in the 1pm updates. Yesterday we hit 2 records. The most vaccinations administered in New Zealand in a single day, 56,843. So far, 72% of New Zealanders aged 40 plus are either booked or have been vaccinated with at least 1 dose. This is great progress. Over 150,000 vaccination bookings were made yesterday too, which is fantastic. Just a reminder, if you are 40 plus or in one of our other priority groups and haven't made your booking yet, visit bookmyvaccine.nz today and reserve your spot. And yesterday, we saw the most COVID tests processed in a single day, 41,464. The fact that we have achieved both these results on the same day is extraordinary and is exactly what we need to do, both to get on top of this outbreak, but also to prepare us for the future. But despite reaching record numbers, we do need to keep going. We need to test to ensure we can get an accurate picture of the perimeter of the virus, and we should also be using this time to increase our vaccination rates. I want to acknowledge everyone who has waited, in some cases many hours, to get a test. You are playing a key role in controlling this outbreak and helping us get back to normal faster. And you can see as a result, we have those record numbers, sometimes 10 times higher than what some of those areas are usually processing in terms of tests. But we do need to take the pressure off the system. We can do that by standing up additional testing capacity. Today, there are 14 community testing centres open across Auckland, including 4 new pop-ups which have been stood up overnight, of which Warkworth opened at 11 a.m. and Takanini will be opening at 1 p.m. today. In addition, 4 community testing centres for close contacts only are in operation today. These are sites that we're using for known contacts to ensure we prioritise their testing. One of the things we heard coming back was people who needed to be tested were waiting in those long lines. We need to move them through. So these are not sites that we are publicly advertising, but those who need to use them are being given the details to try and get them tested more quickly. And in Wellington, 6 community testing stations are open across the region, and this includes 3 pop-ups which were stood up overnight. Do visit healthpoint.co.nz to get details of COVID testing stations anywhere in the country, or call ahead to your GP to see if they have testing available. Our GPs are processing a large number of our tests, and often the wait times are much, much shorter. Just a reminder of who it is that we're focused on testing right now. There are broadly 3 groups of people. Those who are contacts of known cases. If you're called by public health, then you do need to isolate and get a test. The second are people who are at locations of interest on the dates and times recorded. You too need to isolate and get a test. If you went to a location of interest, but not on the date or time set out, then you don't need to be tested. And finally, those with cold and flu symptoms, please isolate and get tested. If you're not in one of these groups, and if you are well, you don't need a test. It is great to have these very high numbers of tests across the country. It gives us that greater sense of certainty. But at the moment, we need to ensure that those who are at risk of being exposed or who are unwell are getting tested. Sitting behind all this testing and vaccinations is an outstanding health workforce. This outbreak has particularly impacted on our frontline workers, even more so than in the past. On behalf of New Zealand, I want to acknowledge how tough the last few days have been and also say thank you. If you interact with a health worker in the coming days at a vaccine station or at a testing station, please pass on the thanks of the team of 5 million. I'm now going to hand over to Dr. Caroline McElnay, our Director of Public Health, to provide an update on case numbers and our source investigation. Dr. McElnay.
Thank you, Prime Minister, and kia ora koutou. Today, I can report that there are 21 new positive cases of COVID-19 in the community. That brings our total number of confirmed cases associated with the current Auckland community outbreak to 51. All cases have been or are being transferred safely to managed isolation facilities using strict infection prevention and control procedures. Of the 21 new cases, 18 are in Auckland and 3 are in Wellington, one of which we reported yesterday. Investigations into the source of these cases continues. 21 cases of the 51 are now confirmed as part of the Auckland cluster, with the remaining investigations still underway to confirm the specific linkage, but initial assessment shows that in the vast majority of cases there is a link. Public health staff are rapidly interviewing cases to establish how the new cases were infected and to determine further details of their movements, and we will continue to release that information as it becomes available. In addition to the community cases, there are 3 new cases to report in recent returnees in our managed isolation facilities. On whole genome sequencing, ESR continues to run sequencing from samples taken from the new cases. They've completed sequencing for 29 of those cases, including the 3 Wellington cases reported yesterday, and they are all genomically linked to the Auckland cluster. On contact tracing, our public health staff across New Zealand are continuing to contact trace with a focus on higher risk locations. That is a team effort involving the Ministry's National Investigation and Tracing Centre and all of the country's public health units, and they're working tirelessly to investigate the cases. Isolation in alert level 4 means isolating yourself away from other household members. So when contacts are identified and traced, it's important that they get tested and isolate until they receive a negative test result. The number of contacts has increased significantly. This is something that we expected as we identify more contacts and test in large numbers. As at 10 o'clock this morning, 5,065 individual contacts had been identified. This number will increase throughout the day as records are fully processed, and we expect to have another 5,000 contacts by the end of today. The majority of those contacts are located in the Auckland and Waikato regions, with a small proportion located in other areas throughout the rest of the North Island and South Island. As at 10 o'clock today, 1,982 contacts were located in the Auckland and Waikato regions, and 266 contacts located throughout the rest of New Zealand. On locations of interest, we are working around the clock to get further details of the movements of cases. We have been hearing concerns about the time it takes to get some locations of interest published. This is a very fast-moving situation, and we do need to make sure that not only do we get information quickly, but that it is correct and accurate, and that can take time to confirm. Also, our contact tracers are dealing with people who've just been advised that they are a case, and they're often very stressed, and so it can take time for people to recall exactly where they've been when they're under pressure. Whilst it does take time to gather that information, we are working as fast as we can to get that information out and to put the list of locations up on the Ministry's website as soon as it becomes available. Also, use of the COVID app allows push notifications to go straight to people who have been at those locations of interest. So that's another way in which we can quickly identify those contacts. I do want to reiterate that if you were at a location of interest at the specified times, please self-isolate and call Healthline on 0800 358 5453 for advice on testing. By calling Healthline for advice, people who've been at those locations of interest at relevant times are logged into our contact tracing system. That means that your swab can be tracked and processed faster by the laboratories. So please do call Healthline. I just want to talk about wastewater. We've had a detection of COVID-19 in a wastewater sample collected from Warkworth on Tuesday of this week. And so our message is anyone who has been at a location of interest at the relevant time or is symptomatic and is in the Warkworth area to get tested. A pop-up testing centre has been set up at 77 Morrison Drive, and this will be open until 5 o'clock. People are asked to call ahead on 09 425 8585. The wastewater catchment area at Warkworth is 3,500 people, and extra wastewater testing will be taken from Warkworth and Snells Beach today and tomorrow. Just on the general comment about wastewater testing, we have got 41 sites around the country covering 3.7 million New Zealanders. Of the 41 sites, 13 are in Auckland and 4 are in Wellington, with further sites also being added. There continues to be COVID-19 detected in wastewater in the Auckland region. Those samples were taken on Thursday. This includes the Waitakere region, the North Shore and Eastern Auckland. ESR expects to receive further samples later today from Auckland, Wellington and Coromandel. There have been no unexpected detections to report from a wastewater sample taken from other areas around the country. And just a bit about Metro Auckland hospitals. You'll be aware that the North Shore Hospital Emergency Department had been closed. It continues to be closed until further notice, with ambulances being diverted to other Auckland emergency departments. However, the hospital is open to direct primary care, medical and surgical admissions with a referral from a GP. On-site staff testing is now in place at North Shore Hospital for both symptomatic and asymptomatic staff. As at 6:30 a.m. this morning, 829 Waitemata DHB staff had been tested. All returned results were negative, and we still have 208 results still pending. 137 staff were identified as potentially being in contact with the positive patient at North Shore Hospital. 84 of those so far have returned a negative result. Of the patients who were in affected areas at the same time as the positive patient, 20 of these are still in hospital. All have been swabbed and their test results are all negative. Public health officials are closely monitoring the situation, and additional support is available for hospitals across Metro Auckland if needed. Back to you, Prime Minister.
Thank you very much, Dr. McElnay. As you can see, our number of cases have grown again, but given the large number of locations of interest and what we know about Delta, this isn't surprising. We have always said cases will rise before they fall. And based on the experience of overseas countries, we do expect cases to continue to rise through to next week before they start coming away. And it's always good for us to share what those expectations might be before we start reporting cases in the coming days. So we do expect them to increase. But there are actions you can take to make sure we don't create new cases or spread the virus in lockdown. One of the things we have learnt from New South Wales is that the virus can keep spreading during lockdown from people going to work or people breaking the rules of a lockdown and meeting up with other people, then passing on the virus. This is one of the key reasons their cases keep going up and their lockdown continues to be extended. And a devastating 825 cases have been reported in New South Wales this morning. No one wants an extended lockdown and no one wants to see that rate of transmission. So the number one thing everyone can do right now is reduce down your contacts and ensure you stick to your bubble. I especially ask that anyone who is a worker at an essential service, make sure that you do not go to work until you get a negative result, and employers have advised you of this too, if you are in those groups of people we've asked to be tested. This morning, I asked our public health team how our compliance was looking, and it was really heartening to hear that the people they are contact tracing are at home. That is exactly what we need. We just need to keep going, because that means eventually our locations of interest will eventually start to decline as we contact trace people who have been at home during their period of infectiousness. On locations of interest, I do have an update in addition to what has been shared by Dr. McElnay this morning. You'll recall that some days ago we talked about genome sequencing helping us to narrow the likely source of COVID to an individual who arrived in New Zealand on the 7th of August. We said at that time, though, that we're continuing to still keep some of our options open. That was because we didn't have a complete sequence, but it was enough to give us roughly 90% confidence in our theory. That sequence was then rerun, and we received the results yesterday. The results of that give us even greater confidence in the match. On that basis, a decision is being made to remove locations of interest that predate the 7th of August. We ask that everyone from those locations still, of course, comply with level 4 restrictions. So you still need to stay home, but you no longer need to report for additional testing. Of course, that decision has been made only recently, so it will, of course, still need to be updated on the locations of interest website. This is an example of how the science can help us narrow the public health measures that are needed in an outbreak. It was absolutely right, though, in a Delta environment for our public health team to be cautious in their approach till we had evidence to the contrary. Just a couple of quick pieces of information before we wrap today. We know isolation can impact on the ability of people to access food. If you're sick or cannot leave home to buy food, you can ask family, whānau, friends or neighbours to make a contactless drop-off of groceries to you. If you are delivering supplies to someone, remember to stay 2 metres apart and wear a face covering. Ideally, though, just drop things on people's doorstep and leave. You can also use your supermarket's click and collect service and ask a local friend, family member or neighbour to drop off the groceries for you. As I said, compliance and reducing contact is critical to stopping the virus spreading. Overall, though, compliance has been outstanding. We're seeing a similar level of reductions in traffic and movements as the last time that we were in level 4. Since alert level 4 came into place, 17 people have been charged with a total of 20 offences nationwide. Of the 20 charges filed, 11 are for failing to comply with the COVID-19 order, 7 for failure to comply with direction, prohibition and restriction, and 2 for Health Act breaches. In the same period, we've had 53 formal warnings issued. Police have also issued 70 infringements nationwide, including 61 to people who failed to remain at home and 5 for persons who failed to wear a face covering. And just a reminder, you do need to wear face coverings when you enter into an essential service like a supermarket. Overall, though, those numbers are really low, so thank you to everyone for sticking to the plan that we know works. Even if we know we have a plan that works, I know the uncertainty of these periods of time in lockdown are really tough and does have a real impact on mental health. Please do not forget to reach out to friends, family and whānau who may be struggling. A phone call, a video chat, a message all really helps. Local GPs are still working at alert level 4 and can provide advice on how to get help to support your mental well-being during this alert level, including phone and video consultations. You can also call 1737 for free-to-talk services, and that's with a trained counsellor. That's 1737. There is more information about how to access the range of mental health support services on the covid19.govt.nz website. Some of the online services there are absolutely fantastic. So please don't hesitate to look, and I encourage you to share that information with others. We are now happy to take your questions. Jessica.
Prime Minister, are you satisfied with the amount of time that it's taken to get those locations of interest on the official website? Because for a lot of people, there's a lot riding on when those pop up.
Yeah, of course, considering that we are in alert level 4, so people should be at home when they receive that information. It may just then give them additional information on whether or not they fall into a category of someone who needs to be tested, and or prioritising those areas where we may have essential workers affected because we need them to stay at home. But there is always a balance here to be struck. On the one hand, if you put up a first cut of information and it's incorrect, so for instance it has the wrong date or the wrong time, you can then have a whole raft of people enter into our testing system that we don't need to. So we're constantly trying to get that balance right, that we have enough information that we believe we can verify before we're putting into the public domain. The second thing to remember is that we are still reaching out to those contacts that we identify, sometimes before they're even up on a website. Our website is not the only way we communicate with contacts, which is a very important thing to remember.
How satisfied are you with in terms of testing, when people are lining up and going to testing centres?
Yeah.
Are you satisfied that there is enough social distancing? There were issues raised with us, like portaloos, for example, that are there for people to use if they're waiting for hours, but whether they were being properly sanitised. How much attention is being put on making sure that a testing place doesn't become a point of...
Well, the first thing, I'll just make a broad statement on testing. In terms of infection control, you'll forgive me if I hand to Dr McElnay for a question on infection control. But when it comes to testing and testing capacity, the number we have had processed since our last report, over 40,000, is extraordinary. I mean, we had a record the day prior with less than 30. So you can see just why we've seen people having to wait the length of time. This is in some cases 10 times our normal demand. Now, on the one hand, it's fantastic. It helps us find those cases. It will help us get out of lockdown. But we don't want people waiting long periods of time or having contacts turn back because of the time they've waited. So, two things: extra capacity has been stood up, and also specific testing sites that are only for those contacts. So we're telling them where to go so that we can rush them through in quicker time. Both of those things should help. But to everyone who's already waited it out, huge thank you. We didn't want you to experience those queues. We've been working very hard on solutions to stop that happening again. Dr McElnay on infection control.
I have every confidence in the district health boards in the setting up of those testing sites, that they are adequately taking that into account in terms of spacing of people waiting, use of PPE. That is a local DHB requirement, but as I say, I've got every confidence in their protocols that they've put in place.
Has that portaloo issue been raised with you? Is that something that has been taken into account?
About the use of portaloos?
Yeah, because if people are using...
I guess there's not really an alternative other than completely individualised stalls. I would hope that people would, however, follow the guidance of making sure they sanitise their hands as they move through any area in which they may have contact with others.
And I'm not aware of that specific situation, but we can get the details offline and make sure that that's been followed up.
Yeah. Jason, and then I'll come back to you.
Just on what you're saying about the numbers rising before they fall and next week, have you got any modelling to suggest what the peak number per day will be?
So I'm always cautioned, I'm always told to be very cautious with modelling in outbreaks, A, early on, or B, with relatively small numbers. They change daily. And so I thought it would be useful, however, that instead of giving numbers because they are so variable for these projections, and you've heard Dr. Bloomfield use some broadly for the totality of the outbreak, just giving a sense that we do expect it to keep us, we haven't peaked yet, that's our view. And I think that's just important to share with people so that they know what's likely to occur, and it doesn't mean that the strategy of our lockdown is somehow unsuccessful. That is to be expected. We're still contact tracing people pre the lockdown who may have been moving about. Soon that will start to fall away, and that's where you see the success of the level 4 restrictions.
The locations of interest.
Yeah.
Dr. McElnay was saying 5,000 significant today,
yeah.
10,000 by the end of today. Is that causing you any concern, this huge number of contacts?
It is a very large number, and what we are seeing with those locations of interest, we are often being very broad when they post them. So to that point earlier, are we happy with the speed? Well, often we're making the decision to be very broad when they're posted, and sometimes they will then narrow. That's in order to just get that balance of getting the information out there in case there are essential workers in there. I'm not concerned by that broad reach because A, we're in level 4, so by and large people should already be at home, and B, with Delta, better to be safe than sorry. Previously with locations of interest, we're really just interested in whether or not you physically had some contact with someone. In a Delta environment, we are being more cautious, which is why you are seeing more contacts, and you'll remember that from our Wellington case. It is deliberately larger. It's all about adapting the way that we're working with Delta. So I think if anyone's looking at those contacts and thinking, gosh, that seems a lot more than we used to have, that's because we have changed the way we're doing things because of Delta. Is there anything
totally agree.
Sorry, I did say to...
So back on the Wellington locations of interest, why did it take so long for that flight from Auckland to Wellington to be identified? And why do people have to wait for that flight to be uploaded in order to be found out that they were at a location of interest instead of being contacted behind the scenes?
Sometimes they do both, but I can't tell you the sequence of when the flight went up relative to when the contact tracing made individual calls. I know in some cases it may have been that it was advertised publicly before. It just depends on the sequencing, but with flight data, we do have your details, so you are able to be contacted. It just might be posted online beforehand.
No, that's right. And the posting online is an extra to get it out to the public at large, what the location of interest is. The public health team are already following up those contacts. And in a situation where we've got a flight and we've got the details of who's on that flight, then those people would be already being contacted, not waiting for it to go up on a website before they take action.
Just on that one, I think it's also, as I understand, quite a cautious approach capturing that flight as well, because the exposure event, the event that we're worried about, actually we believe happened the same day. So the likelihood of that person them being infectious on that plane, but we are taking a very cautious approach with this outbreak in order to get out of it sooner.
That's right.
And
I'll let you finish your line of questioning.
Yeah, one of the hindrances to getting the locations of interest up quickly is that people haven't been using the app, that they haven't been scanning in, and so they're having to go back through their memories and their bank records to do that. Is that what's slowing it down?
I'm not aware that there's particularly underuse of the app. It does take time when you're doing an interview to go through those details, and we use every source of information that we can have. But just to confirm, if people haven't been using the app, then that's when it does take a bit more time to just go through each and every location of interest by day in order to be accurate.
You're right, we do, and we do use someone's banking transactions as a way of prompting their memory, and they will be interviewed often multiple times in order to extract additional information or clarify bits of information. So again, with getting those locations of interest out, it can be iterative, and we're balancing putting sometimes what might not be quite accurate information out there more quickly.
Prime Minister, can you just say,
Henry.
So you're saying it's still going to peak, we're not at the peak yet. Lockdown.
Don't believe so, of course. I don't have a crystal ball, but my instinct, and I am not an expert, but my instinct from our more than 12 months of experience would be no, I wouldn't have thought so, no.
But given that, can you sketch out, I guess, a bit more of the future post Tuesday? Because it seems unlikely that we're going to go to, at least Auckland's going to leave level 4 on Tuesday. If people are planning things early September, late August, should they put those on ice?
Well, that's really asking me to cast into the future. We do want to base our decisions on evidence. You would have heard us yesterday, though, when we asked all of New Zealand to remain where they are in level 4 through to the end of Tuesday, with announcements on Monday about the plan casting forward. I did give an indication that Auckland can obviously see that they're sitting at the centre of this outbreak. So it's very likely that we're going to have to take measures there that continue to be cautious. Having said that, I don't want to predetermine what happens for the rest of New Zealand either.
With these free supermarkets in Wellington that are locations of interest, all the staff, who I understand, who were there at that time, have to also self-isolate. Is there any plans around the government, or any thinking about how to basically ensure that food supply still goes well? Because that's quite a large number of supermarkets in communities.
Actually, Dr. David Clark who holds ministerial responsibility for this area, has been in talks with our supermarket chains around what can be done to ensure that they're using practices and measures that enable ongoing supply chain and also ongoing operations. There have been a couple that have been offline for long periods, although sometimes you'll find they shut down completely. Then once they work through shift details, likely contacts, they can get themselves back up and running. But he is talking with them about the kinds of contingency they have in place. One thing to also add, there is a drive-through vaccination station being set up in as if I recall, the Auckland DHB, specifically around some of that essential workforce in the first instance, to be able to get a bit more throughput to some of those people who are in our supply chain. So not just checkout operators, but the thousands of people who keep food moving through the country.
Is it your understanding that all the families in the Wellington outbreak have been cooperating with contact tracers at this point?
I've heard nothing to the contrary, no. I'll just look away.
Prior to this outbreak, Māori and Pacifica doctors were cautioning that if there was a Delta outbreak, it could be devastating for Māori and Pacifica communities. Now with De La Salle being one of those schools, over 80% of those children are Pacifica, and the likes of Porirua, highly populated with Māori and Pacifica communities, are you concerned that what they were predicting is something that could be devastating for Māori and Pacifica might just be happening?
So, every part of our strategy has always been designed around Aotearoa New Zealand's population. So we already, of course, knew that if we had, even before Delta, if we had a COVID outbreak, it would be devastating, particularly for our Māori and Pacifica communities. And that's often down to the way our communities live, but also some of the health inequalities we have in New Zealand. So that is part of the reason we have an elimination strategy, is to prevent that devastation across those communities. It's why we are in level 4, is to prevent that devastation in those communities.
Can you give us more
we do have enough time. I will pan back to you. I'll just take a few questions from the others.
Can you give us some more details of the 21 new cases today? We've heard that some of them are linked to schools and universities in Auckland. What about the others?
Yeah, so for some of them, and I'll obviously bring in Dr. Makune as well, for some of them, case investigations, those interviews are still ongoing. But even from the first cut of that information that's coming through on our update today, we were informed that, broadly speaking, there's a view that they are predominantly likely to be linked to a cluster based on the first blush of information. But you'll forgive me for not getting into the specificity, because those interviews are still underway. We get the results through in the morning. Our public health units are straight in interviewing, and then locations of interest go up. One quick point on locations of interest, we are looking to try and sequence the timing of when they go up in a more predictable way, so certain times of the day, so that people know when to go back and look. That's one of the things we think we can do to make it a bit easier for everyone. So we'll give you an update on that work.
On the Auckland University student who's now in Wellington,
correct.
Did they get tested before they left Auckland and then travelled to Wellington?
I've certainly not had it indicated to me that they did anything inappropriate, so I wouldn't want to leave any suggestion there. They travelled within the 48-hour window back to their home, which of course was all within level 4 guidelines. Before that, I couldn't comment on the sequencing of their testing.
I'm only aware that they were tested in Wellington.
Yeah.
Why airports?
So, if I may,
So, I don't believe we have the flight for that student this year. I could be wrong.
let me go back and check with you, but again, when we have the flight details, that's one of the ones that is a little more straightforward for us to contact trace.
And why is it that airports, airplanes obviously been listed as locations of interest, but airports haven't been? Apparently Wellington Airport asked the Regional Public Health Authority on Friday whether it was a location of interest and hasn't really had a response.
Look, I couldn't comment on specific details for the public health units and locations of interest, but what I again would say on that flight, that one is very much on the cautious side. The public health unit may have made a decision because of the way, of course, that everyone is in close proximity on a plane versus walking through a much more expansive airport, may have made a distinction between those two. Right. I wouldn't want to hazard a guess. But
the Sunday night flight, the exposure event was that day.
Was the same day.
Much lower level of risk.
Again, very, very cautious approach being taken there by putting that as a location of interest when it was on the same day they had contact with a case. Very cautious. Yeah.
Just on back to essential workers being vaccinated, where are we at with our essential workers vaccination, and how long are we diverting vaccinators to testing centres for?
Well, as you can see, obviously we are managing to do both. I'm not for a moment suggesting that isn't without extraordinary work from our health workforce, but the fact that we have record vaccination on the same day that we have record testing demonstrates that that at the moment we're doing both at full capacity without that loss of service. As I quickly mentioned, the Northern Region Health Coordination Centre is launching a vaccination centre on Sunday that will be able to vaccinate a large number of individuals, up to 2,000 per day, starting off a little lower than that, but ramping up. And there is a specific focus on essential workers for that vaccination centre. So that will be by appointment only so that they can bring through that essential workforce in that drive-through environment.
On that, so does that mean that our vaccination centres are all now open again?
No, so not all of them are operating, but we have, of course, remember with our ramp up, we were onboarding primary practice, so GPs clinics. That has continued, and so if there are centres that aren't operating at present for a number of reasons around level 4, we have at the same time brought on new sites, and so that is why we've managed to continue to scale up. Anything further on that?
No.
Yeah. Oh, sorry, Claire.
When you say that they're all linked to the cluster, can you say how many?
At this stage, the view is that they are, yes.
Yeah,
many,
at this stage.
Many.
Do you know yet how many got it because they're, I guess, personal contacts of other cases versus simply by virtue of being at a location of interest?
Yeah.
And are there any locations where there is a particular issue
If-
with spread
yeah.
at this stage?
Good question.
Also,
Yep.
are any of the positive cases so far vaccinated?
So our public health units have been collecting that data. I can't speak to that at the moment. You already know about the one that was fully vaccinated. I believe there might be others, but I can't say for sure at this point. Obviously, we're treating everyone in the same way, so it's interesting information, but not necessarily changing our approach. On the issue of those events, one of the conversations that we had with the public health team, and they advised us what they have underway at the moment, is working through, as they're interviewing and identifying the connection, working through those events where it appears that there may have been more infections amongst those who may not necessarily have identified themselves as being close contacts, but were just at the same event. So that will enable us to really hone in on whether we have particular events that would fall into the category of being super spreader and therefore ones that we should continue to pay extra attention to. So that's all part of the process of interviewing and identifying where people came into contact with COVID.
Anything been identified or early flagging of yet though?
I think I'd want to, before I did that, I think we'd want the public health unit to finish up doing their interviews. So maybe if we come back to you tomorrow and just give you a suggestion of some of those locations that we think look like they were more problematic than others.
Yeah, I think that's right. We've still got some analysis to do, and we'll be able to then also break that down into where people were at a location of interest versus being a contact of a case.
Yeah.
So we should have that.
And that's particularly what they're looking at the moment. Can we see, are there certain sites that we think are more worrisome than others? But again, you never want to take your foot off the brake because that might lead people not to be tested at certain locations of interest, and that we wouldn't want that either. Yeah, Jason, and then I'll come back over to the side.
It's being reported that a New Zealand citizen accused of having ties with ISIS has reportedly arrived in New Zealand. Can you confirm this?
No, obviously that will be a case that I won't be commenting publicly on. For a range of reasons, not least security reasons.
But just on that particular issue, I won't go into many details, but the person in question here, what is the isolation arrangement for said person? Are they going to be in with a general cohort, or would that person be in with?
I think the most important point for me to make here is that we are undertaking all of the usual COVID-19 related protocols for someone who has come in from a country that has COVID in circulation, which is essentially anywhere in the world at present. So we will follow those same protocols.
In terms of public safety, what guarantee can you give to the public that they will be kept safe with her here?
The same, I would give the same reassurance that I have all the way through. That whilst we have obligations, given that this individual that we're talking about is a New Zealand citizen, and of course the status of their children, We have, however, still undertaken all of the usual steps that you would expect us to take to keep New Zealanders safe. That has been an absolute priority. And whilst there's some constraint on my ability to talk about the details of those, I can tell you that we've used every lever we have to ensure people's safety.
You are asking New Zealanders, though, to effectively trust you without giving too many of the details. In terms of...
Not me, but our systems, yeah.
But in terms of that, how are you balancing the public's interest and safety and right to know with the fact that you need to keep some of that safe? Will you be releasing more details on the public interest side of things later down the track?
No, the key test for me is, my job is to keep people safe, and we are using all of the levers that we have to make sure that we've done everything we can to keep people safe, while at the same time fulfilling those obligations we have, because this is a New Zealand citizen. There isn't really an option here. The alternative would have been to say to Turkey that we don't take responsibility, and they could have then deported that person without warning and without our preparation. That would have been wrong. That would not have ensured the safety of New Zealanders. So we've planned for it, we're ready for it, and we are keeping in mind here there are also children involved that we have an obligation to as well.
Yeah. Thank you. I just have a few on behalf of colleagues, if that's okay.
I love how no one ever takes ownership for their colleagues' questions. You fire away, though.
I have one from my hosting over here.
You've had a couple already, so go ahead.
Thank you. Would you consider ring-fencing the North Island from the South Island to contain the virus? Why haven't the De La Salle School and Macaulay School high school locations been identified as locations of interest, given that they've already informed staff and students? And thirdly, butchers are begging to be open for click and collect. Why are they unable to do that?
I'll start with the last one first, because of course at level 3 we have the ability for them to operate, but it is much more limited at level 4. And that's always been our approach: reduce down as much contact as possible so that you don't end up in a situation like New South Wales. On the second question around locations of interest, in a way you answered it yourself. Yes, of course, we do work to get these up on a public website, but as you've already acknowledged, staff and students, the most important group we want to contact, are already being contacted and prioritised, and that is key. They're the ones we want staying home, and they're being notified as a priority. On the issue of North and South, we actually consider all options depending on where we have concerns. So if there are places in the country that we're worried about, we look at how we can practically implement borders around them if we need to have different alert levels. So we keep all options on the table. That includes whether a boundary exists around one city or around a whole island. Did you want anything further going on the location?
Prime Minister, on vaccination.
Sorry, you haven't had a question.
Johnsonville and Miramar have been named as the home suburbs of the first 3 Wellington cases. We've seen lots of locations of interest for Johnsonville. Should people in Miramar be expecting locations of interest to pop up there?
Keep an eye out. I know that some additional locations of interest were uploaded this morning. Please take a look at those. But do just check for the locations. It's not a matter of because someone lives in a suburb, that whole suburb somehow is problematic. It depends. It's all about where someone has been and at what time they've been there.
That's right, and there is variability between individuals in terms of what they do. And I've been informed by the medical officer of health there that these cases have not been out and about particularly, so we would not expect to see locations of interest.
Young people, however, move around a lot.
On vaccines, 56,000 that's about 1% of the population in a single day, pretty high rate. On that number you would finish early December if you keep that rate up. Are you expecting that that's the top of the curve, or do you think it could ramp up to 65k?
Let's see what's possible. I don't want to put definitive numbers on that yet. I mean, we're seeing that ability to just, even in these circumstances, be able to create and generate those kind of numbers is fantastic. And we've got a way to go yet. We haven't opened up to the entire population yet, so I wouldn't want to speculate on that front. But we have worked very hard to put ourselves in the position where we can complete as much as possible this rollout this year. That's been our goal.
On first dose priority, you've moved it so first doses are prioritised. On first doses, you'd get to 80% of the entire adult population at first doses around October 20. would one think that after 80% of the entire adult population has had a dose, that would lessen the risk of this happening again?
Not based on every other country around the world, unfortunately. Even those countries with some of the highest rates in the world have Delta outbreaks. And the thing that I would say is that does not mean that there is an issue with the effectiveness of vaccine. Not at all. What we are seeing is a significant reduction in hospitalisation and severe illness. So the vaccine is doing what it's meant to do. But our strategy has always involved vaccination plus good public health measures. What we want to do, though, is with really good reach and full vaccination, not just one, full vaccination, reduce down the need to be at this extreme end of public health measures, which is lockdowns, using things more like those infection controls, making sure that we are protecting ourselves at the border, and contact tracing when we have cases that come up.
Believe that it's November, the vaccine rollout's going well, but it's not quite finished yet. And another case like this happens, we're back in level 4.
Oh, you've been highly speculative there. Our goal, and this is my singular message, my very simple message, please go and get vaccinated. It reduces down the risk of us being in this situation, and it reduces down the need to use these more extraordinary measures. And it saves lives.
And on this specific outbreak, obviously we're far too behind to be able to vaccinate our way out of it. That's not the strategy right now. The strategy right now is level 4.
Well, again, I want us to get back to levels of freedom. People, even countries with really high vaccination rates, are bringing in restrictions alongside high vaccination because they have Delta outbreaks. So our goal at the moment is let's deal with this outbreak. Let's get us back to those freedoms. And I absolutely believe we can do that. We're on track to do that. Everyone just needs to stick with it. I'll take the last couple of questions if I may. You haven't had one.
Prime Minister, what's the capacity at the Jet Park quarantine facility, and what happens when it gets full? What impact on MIQ spaces?
Yeah, a good question. We were just having that conversation this morning. It's not at capacity. We do have extra space there. We are prepared, though, if we have additional cases, we have some extra capacity. We're able to prioritise having cases at the Jet Park and perhaps using other facilities where you've got family household members so that you're not having to isolate them together, but if they are at risk, you're able to isolate them in another facility. So we've already done that work and confident that we can manage. I'll let you finish, yeah.
Generally speaking, with massive queues at testing centres and hospitals not having substantially increased ICU capacity in the past year or so, has the government done enough to prepare for it?
Well, actually, we do have considerably more ICU capacity we're able to stand up than before the COVID outbreak. So that's certainly the message we've had from Dr. Bloomfield. Of course, our goal is to not use the ICU capacity.
The question, has the government done enough to prepare for a Delta outbreak?
Our goal, of course, has always been to do everything we can to prevent it entering in at the border, but at the same time acknowledging we're one of the last countries in the world that has had Delta in the community. So with even the best measures possible, you still have to be prepared for this scenario, and you still have to have a plan for this scenario, and we do. And that's what we're activating now. I will just... Rukuwai, I'll let you...
Considering the makeup of a lot of Māori households, intergenerational, has there been any struggles with trying to isolate people away from their families within the one house? And if there has been, what's been done to deal with that?
Yeah, perhaps Dr. McElnay.
I don't have specific details, but we're very aware of that situation, and that was a conversation that we were having this morning with the Auckland District Health Board around how to enable and support families to be able to do that. Obviously, for cases, we've got the ability we have the Jet Park facility where cases go, but we're also looking at a facility that we can then accommodate close contacts who can't isolate easily from the rest of their household. So we're looking at different ways in which we can support families.
Overcrowding in homes, how big of a risk is that to the way people can isolate?
It certainly is a challenge, and we do know with the Delta variant in particular that household transmission is a very real likelihood, and so it is important to, particularly when we know that we've got a case. That's why we do have a different accommodation option for people who are identified as cases. But it is something that when people are identified as being at a location of interest, to separate as much as they can from the rest of the household, but also it's about the importance of getting tested as well, because until we've got that test that is a test negative, we really don't know what we're dealing with. So we're taking a very precautious approach at all times.
It is one of the reasons I think we can expect to see numbers go up, is because with Delta, previously you'd see some infection in households, but not necessarily the entire household. On these occasions, and overseas experience is telling us you can almost certainly see very high rates of infection amongst households. So that's another reason why we do expect those numbers to go up. Yeah. I'm going to give, I felt like I was a bit dismissive of Jason, but he's not seeking another question, so...
I've got one if you want.
No, if you don't persist, I'll give it to you on the front and then I'll finish.
On Afghanistan, the situation isn't improving there, particularly outside the Kabul International Airport. Kiwis have been asked to travel to the airport to try reach evacuation, which obviously isn't happening right yet, and are getting turned away because of the crowds and the Taliban checkpoints. What's your understanding of the situation on the ground as it stands, and do you think the evacuation mission is still viable?
I certainly think it's being hampered. There is no question. And that was something that we were advised of by officials at the point that we deployed our asset into the region to try and assist the evacuation. Our, of course, role, though, is to support the evacuations generally, and all partners are working together. They won't just be bringing out their own people, but often supporting others, and will be a part of those efforts. But I am concerned that because of the situation on the ground, that we do need to start working on what the next stage will be, because it does not look like we are going to get everyone out that we want to get out. A bit too early to say right now, but there is a certain window which everyone is using in order to try and use the secure space that is available at Kabul Airport. But it is an entirely separate issue of people's ability to safely connect with the airport. And obviously, as you can see, international partners haven't been in a position to be able to secure safe routes for people to get there. The next issue is that not all of the people we need to reach are even in that province, and in fact are in a province that is completely separate, and we've not yet been able, no one has yet been able to connect them to Kabul.
Are we basically going to arrive there too late?
No, I don't believe so. And as I say, we are part of an international effort that does not just involve us uplifting our people. We're working together so that if we're in the position to bring out whomever needs to come out on our assets, and our partners are doing the same for us. It's just not an environment where anyone is picking and choosing. We're just doing our best.
Why haven't we been able to get anyone on Aussie planes, for instance, so far? Has that request been made?
We are working very closely together, and as I've just described, I expect we'll all be picking up one another's citizens and Afghani nationals. And I'll let you finish this line and then we'll wrap. Thank you.
Humanitarian question. A lot of countries we're partnered with, I think Chris Clark was in a meeting the other night, have made offers of 20,000 refugees over the coming 4 years. Will Cabinet consider making a similar offer to Afghan citizens?
You'll know that in previous decisions that we've made already have been around broadly increasing our refugee numbers. Too early for us to say what the makeup of those of Afghani nationals will be amongst that. But you can see this is going to be an area where there will be a large number of refugees in the future, and that's something we'll work through. Thank you, everyone.